Something is wrong. You can feel it. It started a few days ago. Maybe you thought it was just a cold or exhaustion from work, or perhaps something you ate. But deep down, there is a quiet alarm going off in your body, and you cannot quite explain why. What if that alarm is trying to tell you something far more serious than you realize? Hantavirus is not a disease most people think about. It does not appear in everyday conversations. It does not show up in TV commercials warning you to get vaccinated. In fact, most people go through their entire lives never hearing a single doctor mention it, until the moment it becomes too late to ignore. And that is exactly what makes it so devastatingly dangerous. This is not a disease from a faraway jungle or an ancient history book. Hantavirus is here. It lives in the fields, the forests, the rural outskirts of towns, and, far more commonly than most people suspect, inside homes, garages, cabins, and storage sheds that have been visited by rodents. Mice and rats carry this virus silently, shedding it through their urine, droppings, and saliva. You do not need to touch an infected animal to contract it. You simply need to breathe in air contaminated with microscopic particles from their waste. One breath. That is all it takes. And once the virus enters your body, it begins a silent battle, a battle that most people mistake for something far less serious. The terrifying reality is that Hantavirus pulmonary syndrome, the most severe form of this disease in the Americas, carries a fatality rate of approximately 38%. That means nearly 4 out of 10 people who develop the full syndrome do not survive. The ones who do survive are often the ones who recognized the warning signs early and sought medical attention before the disease reached its most catastrophic phase. That is why what you are about to learn could save your life, or the life of someone you love. The first sign is a fever that feels ordinary but refuses to leave. In the early stages of hantavirus infection, the body mounts a classic immune response. A fever appears, usually between 101 and 104 degrees Fahrenheit, and it brings with it the familiar misery of chills, sweating, and that bone-deep exhaustion that makes even lifting your arm feel like an enormous effort. Most people at this stage assume they have the flu. They take some over-the-counter medication, drink fluids, and wait it out. But here is the critical difference. The fever from hantavirus does not follow the typical arc of a flu. It does not gradually ease after a few days. It persists, and it often intensifies. If you have had a high fever for more than 3 or 4 days with no improvement, especially if you have recently spent time in a rural area, a cabin, a barn, or any space where rodents might have been present, you should take that fever far more seriously than a simple seasonal illness. The second sign is severe muscle pain that goes far beyond normal soreness. This symptom is so distinct that doctors who are familiar with hantavirus consider it one of the most telling early indicators. The pain is not the mild achiness you might feel after a long workout or a day of heavy lifting. This is a deep, intense, sometimes debilitating muscular pain, particularly concentrated in the large muscle groups of the thighs, hips, back, and shoulders. Patients have described it as feeling like their muscles are being wrung out like a wet cloth. It can make walking difficult, sitting uncomfortable, and sleeping nearly impossible. The pain can appear before the fever intensifies and often catches people off guard precisely because they do not connect it to a serious infection. If you experience this level of muscular pain alongside a fever, that combination alone should raise a red flag. The third sign is a headache that feels like pressure from the inside out. Headaches are incredibly common, and most people dismiss them without a second thought. But the headaches associated with early hantavirus infection have a particular quality to them. They are severe, persistent, and often described as a pressure-like pain that radiates across the entire head. They do not respond well to standard pain relievers. They linger for hours, sometimes days, and they tend to worsen as the infection progresses. Combined with fever and muscle pain, a severe and unrelenting headache becomes part of a triad of symptoms that clinicians call the prodrome, the warning phase before the disease shifts into its most dangerous stage. The fourth sign is dizziness and a strange sense of imbalance. As hantavirus begins to affect the body's fluid regulation and cardiovascular stability, many patients report feeling unexpectedly dizzy, not just mildly lightheaded, but genuinely unsteady, as if the room is tilting or their legs might give out beneath them. This can happen when standing up suddenly, or it can be present even while sitting still. Some patients describe a disconnected, foggy sensation, as if they are watching themselves from a slight distance. This neurological component is the body's early warning that something systemic is happening, that this is not simply a localized illness, but something that is beginning to affect how the entire organism functions. Dizziness in the context of fever, muscle pain, and headache should never be ignored. The fifth sign is nausea, vomiting, and abdominal discomfort that mimics a stomach bug. Here is where hantavirus becomes particularly deceptive. In many cases, the early phase of infection includes gastrointestinal symptoms: nausea, vomiting, stomach cramping, and sometimes diarrhea. Patients and even some healthcare providers initially attribute these symptoms to food poisoning, a stomach virus, or gastrointestinal distress. The patient is told to stay hydrated and rest, and so the critical window, the window where early intervention might make the greatest difference, quietly closes. The important distinction is this: if gastrointestinal symptoms are appearing alongside high fever, intense muscle pain, severe headache, and dizziness, the combination is no longer consistent with a simple stomach bug. It is consistent with a systemic viral infection, and hantavirus must be considered, especially if there has been any possible exposure to rodents or their environments. The sixth sign is the most urgent: the arrival of breathing difficulties and a persistent dry cough. This is where everything changes. This is the moment when the body begins to signal that the lungs are under attack. In Hantavirus pulmonary syndrome, the virus triggers a catastrophic immune response in the lungs. Fluid begins to accumulate in the lung tissue. Breathing becomes labored. A dry cough appears and progressively worsens. Patients describe a sensation of tightness in the chest, as if a heavy weight has been placed directly on their sternum, making each inhale feel like a conscious effort rather than an automatic reflex. This symptom can escalate with shocking speed. In some documented cases, patients went from feeling mildly short of breath to requiring mechanical ventilation within 24 to 48 hours. There is no overstating this. If you or someone you know develops breathing difficulties alongside the other symptoms described here, this is a medical emergency. Time is not on your side. Every hour matters. The seventh sign is a sudden and dramatic drop in blood pressure. As the lungs fill with fluid and the cardiovascular system comes under increasing strain, blood pressure can plummet. The heart begins to work harder to compensate, and the body enters a state of shock. Patients may feel an overwhelming wave of weakness, extreme pallor, rapid heart rate, and a sense that something is catastrophically wrong. Because it is. This is the final alarm before the body begins to fail. It is a sign that the infection has moved beyond the prodromal phase entirely and into a full-scale medical crisis. Survival at this stage depends almost entirely on immediate intensive care intervention, including oxygen support, careful fluid management, and, in some cases, extracorporeal membrane oxygenation, a last resort intervention where the blood is oxygenated outside the body. Now you understand why early recognition is everything. Here is what you need to know about exposure risk. The deer mouse is the primary carrier of C. nombre virus, the most common strain of hantavirus in North America. But other rodents in other parts of the world carry their own strains. If you have recently cleaned out a shed, a basement, a storage unit, or an old cabin, especially one that showed signs of rodent activity like droppings or nesting materials, you have had a potential exposure. If you have been hiking or camping in areas with dense rodent populations, You have had a potential exposure. If you live in a rural area and have noticed rodents in or around your home, you have had a potential exposure. Prevention is straightforward, but requires strict discipline. Never sweep or vacuum rodent droppings dry. This sends particles into the air. Instead, saturate the area with a disinfectant solution, let it sit, and then carefully wipe and dispose of materials using gloves and a mask. Seal any gaps in walls, floors, and roof lines that might allow rodents entry. Store food in airtight containers. If you are working in a heavily contaminated area, use an N95 respirator or higher. And above all, if your body begins sending you those 7 signals, do not wait. Do not take a second dose of cold medicine and go back to bed. Do not tell yourself it will pass in a few more days. Go to an emergency room. Tell the physician about your possible rodent exposure. Ask them to consider Hantavirus. Be your own advocate. Because the doctors who save lives from this disease are the ones whose patients gave them enough time to act. Your body is always communicating with you. It speaks in the language of symptoms. Subtle at first, then louder, then urgent. The difference between a full recovery and a tragedy is whether you learn to listen before the message becomes impossible to ignore. You now know the 7 signs. You know what they mean. And you know that if they appear together, especially after a potential exposure, the only right response is immediate medical attention. Share this information. Pass it on. Because somewhere out there, someone is dismissing their symptoms right now, and the knowledge you just gained might be exactly what saves them.